Hey everybody, this is Dr. Vince from FTR in Joliet. Today we're going to cover a vestibular exercise. Now vestibular is a big word, but it really just means that it's a small organ that sits behind your eye. Who cares, right? But the reason why it's important is because if there's a problem with this vestibular apparatus or this organ, patients can feel dizzy or unsteady when they're walking. Now there's some certain tests that we do in physical therapy to determine if this is actually a problem, but let's just make the assumption that you've had an evaluation by a physical therapist and you've been given treatment. Now I give my patients this exercise frequently, and it's called VOR1. The reason why I'm doing the exercise on video is because I want my patients to be able to reference this. So if you haven't had an evaluation by a physical therapist, this exercise may not be for you. If you're feeling dizzy or unsteady and you want a professional evaluation, give us a call. So the way to perform this exercise is you'll hold a card at arm's length, you'll keep your eyes focused on one part of the card, and you're going to turn your head left and right, keeping your eyes focused on that one part of the card. Ideally, this should be done at about 120 beats per minute. So for those of you that are at home, you can go onto Google and search metronome, and you can increase that rate up to 120, and then it should look something like this. If at any point in time that card or that letter or whatever it is that you're staring at starts to get blurry, slow down just a little bit. Okay, that's an error signal, which means that your eyes are having trouble focusing on the target that you're looking at. And that happens because your eyes may not be able to keep up with the head movement, which is an indication that there may be a vestibular dysfunction. Obviously, during the evaluation, we would have found that with some special tests. But the exercise should be done for as little as a couple of seconds, because some patients may start to feel nauseous when they're doing this, which is why you do not do this exercise unless it's been given to you by a physical therapist or a physician. Also, if you don't feel nauseous, you may start to feel unsteady after doing this exercise, because by stimulating this nerve, it may actually, you may be overworking it if you do it for too long. So again, only do this exercise under the supervision of a physical therapist or a physician. Ideally, the exercise should be able to be done for 1 to 2 minutes at a time and should be performed, roughly 3 to 5 times per day. If at any point in time you're getting that error signal, blurred vision, nauseousness, feeling unsteady after doing the exercise, back off for how long that you're doing the exercise for. So instead of 2 minutes, you may cut it down to 1 minute, or instead of 1 minute, you may cut it down to 30 seconds, or as little as 3 to 4 seconds at a time. But the goal is to build up your tolerance over time and to improve that error signal, so that way you don't feel unsteady when you're turning your head when you're walking, or your vision doesn't become blurry, which is called oscillopsia. And so there's a lot of big words when we're treating vestibular issues, balance issues, but don't be intimidated because the exercises are not that difficult. But again, they should be performed under the supervision of a physical therapist or a physician. Thanks for watching.